Hey, CEimpact subscribers, welcome to the GameChangers Clinical Conversations podcast. I'm your host, Josh Kinsey, and as always, I'm excited about our conversation today. Uncontrolled hypertension remains one of the most significant and preventable drivers of cardiovascular disease and poor patient outcomes. In this episode, we'll discuss how pharmacists can take action to close care gaps, support effective treatment, and help patients achieve better blood pressure control. It's great to have Ryan Jacobson as our guest today. Ryan, thank you for being here.
Thanks, Josh. It's great to be here.
Yeah, so for those of our listeners that don't know you, go ahead and take a couple of minutes, introduce yourself, tell us a little bit about your practice site.
Yeah, thanks. Thanks for inviting me to be here. It's great to finally be on your podcast. I've listened to a few and have really enjoyed them. So I'm
Awesome.
I'm a clinical pharmacist here at the University of Iowa Healthcare. I've been here for over 20 years now in the ambulatory care arena. And I've worked in a number of different areas, ranging from general internal medicine to anticoagulation management, geriatrics, nephrology. And for probably the past 10 years or so, I'm the clinical pharmacist in our heart and vascular clinic. So I spend my days working side by side with our team of cardiologists and nurses, and most importantly, our patients to try to optimize their cardiovascular health. I'm also a faculty member, an associate professor with the University of Iowa College of Pharmacy. So it's great to be.
Yeah, great. Well, thanks for taking time out of your summer schedule to join us for this. You're certainly well poised as the expert here, being in the cardiovascular clinic. So we really appreciate you imparting some of your wisdom on us. So with that, as I always like to do, kind of lay a foundation for our listeners just to kind of make sure everybody's on the same page for what we're going to talk about today. So let's talk about uncontrolled hypertension. Like is there a specific definition? What does it mean when we say a patient is uncontrolled? And what are some of those, like, how do we identify that is it a certain time frame? Is it a certain reading for so many times? If you can just kind of speak to the idea of uncontrolled hypertension for a little bit.
Yeah, and even a little bit more background. Hypertension is well established as a leading cause of cardiovascular related morbidity and mortality. It's the leading preventable cause of cardiovascular death. In fact, it's second to only cigarette smoking in terms of overall preventable deaths. Despite the fact that we have well-established treatments that lower that morbidity and mortality, we're still not controlling hypertension. And so this is certainly a timely topic, although it's been over 15 years ago now. There was sort of a call to action in a New England Journal article that highlighted the fact that hypertension is such a significant driver of cardiovascular disease. Yet we are falling far short in controlling that, despite well-established therapies and high-quality evidence. It's estimated that approximately 50%, maybe a little bit lower than that overall, of adults have hypertension. Of course, those prevalence rates vary a little bit in older individuals over the age of 60. 70% of patients have hypertension, and younger adults, those rates may be as low as 25%. Amongst those patients that have hypertension, about 60% are aware. And that means 40% are unaware. And I know the focus of today's podcast is really on uncontrolled hypertension. And I think, your goal is to probably address those patients who've been diagnosed, who've been prescribed a therapy, whether lifestyle or medication, and aren't achieving their goals. But I think we'd be remiss today if we didn't also highlight the fact that 40% of patients with hypertension aren't even aware of it.
Right.
So go ahead.
Yeah. And well, I was just going to say, to me, that is also, a potential secondary definition of uncontrolled hypertension, because it is uncontrolled, because they don't even know they have it. So, yeah.
Absolutely. So I think, and once we get to some strategies, I want to highlight some things I think we must do to increase awareness so that we can best care for those patients who don't even know they have high blood pressure and are therefore at risk of some of the long-term complications. Amongst those patients that are aware of their disease, about 60% or so, 50% are prescribed medications, but only 20% are achieving their treatment goals.
Hmm.
And so that's really that patient population we're going to talk a little bit more about today. And there's a big opportunity throughout the system of care to address this really significant unmet need.
Yeah, yeah. I mean, just if anybody got lost in all the data there, the fact of people who are uncontrolled is significantly high. Like that's the take home point, is that
That
it's just, I
yes,
mean, in addition to the fact that pretty much 1 in 2 people that you meet are going to have hypertension,
yep,
the likelihood of them being uncontrolled is also extremely high. So that's great background, great information. I appreciate that. Can you speak to a little bit about, well, is there a specific, like, how do we classify someone as saying you're uncontrolled? Like what gets us to
yeah.
that point?
So, in order for a blood pressure reading to be considered accurate, good technique is essential. And this
Hmm.
starts with diagnosis, and it continues all the way through management and monitoring to make sure patients are achieving their treatment goals. So, while we don't have time today to maybe go through all the steps of accurate measurement, it really starts with that.
Hmm.
Um, and so making sure that we have a good measurement of their blood pressure is the starting point. Now,
Yeah.
remind me the question again, or your
Well,
point.
yeah, no, the specific question was like, how
How
do
do we
we
know?
how do we
Yeah.
say that someone is uncontrolled? Like, is it
Yep.
X number of readings over, whatever that are high, or is it,
Yeah.
yeah,
Yeah. So I was running all the steps of the proper technique through my head, and I lost my train of thought.
sure.
Um, So, in order to consider an accurate reading, we need the average of at least two readings on at least two different occasions. And so, generally speaking, once a patient's been diagnosed, that's something that we should also highlight today is that home blood pressure monitoring should really be a key part of patient management.
Hmm.
In fact, it's even recommended that home blood pressure monitoring be used to confirm the diagnosis of
Mm,
hypertension.
mm.
Um, some patients have white coat hypertension, or some patients will have what we call masked hypertension, where they actually have normal office blood pressure readings, but they have elevated readings at home.
Interesting.
Um, and so, if patients are monitoring their blood pressure regularly, and generally that would be um, on a day-to-day basis if we're in the process of optimizing their treatment. Certainly some patients get into a situation where they're checking their blood pressure too frequently, and that can drive a lot of anxiety
Hmm.
unnecessarily. And so every patient's going to be unique in terms of the frequency of blood pressure monitoring, but at least on a weekly basis, if those average readings and they're checking it correctly are above their treatment goal. And just to highlight, the treatment goal for the majority of patients is going to be less than 130 over 80, based on the latest iteration of the American Heart Association guidelines, which were published in 2017. It's worth noting that there's an anticipated update coming in August.
I was
Um,
just fixing to say, I think there's something coming soon, isn't there? Yeah.
Yep, the next iteration of the guidelines is scheduled to be released in August. So we'll look forward to those. But I think suffice it to say that home blood pressure monitoring is going to continue to be an important part of patient management. And
Yeah.
so, and usually what I tell patients, if you have an occasional reading above your treatment goal, it's not anything to get overly concerned about. But if the majority of your readings that we're seeing over a given time frame are above that treatment goal of less than 130 over 80, then really that's a situation that warrants attention and digging
Mhm.
into what may be driving suboptimal treatment.
That's great. Yeah, and you mentioned something there that I want to touch on, and we're going to touch on it later in more detail. But that's an opportunity for the pharmacy teams to really get involved with proper technique of testing at home. That's something where we can provide the education, we can oversee the process, give tips, tricks, that kind of thing, and also make sure that they're buying a reputable product, something that is known for giving good results and that is, user friendly and stuff like that. So another opportunity for pharmacies to for pharmacy team members to get involved with that process. So
yeah, and I think I'll just add, since it came up in the discussion in terms of treatment goals, I think that's a big opportunity to reinforce throughout the continuum of care. Believe it or not, most patients are not familiar with what their treatment goal is. A lot of patients, I'll ask them, well, what's your treatment goal? What do you know about your treatment goal? Oh, well, either I don't know or less than 120/80. Everybody kind of remembers that number. So I think, this is a big opportunity for pharmacists, especially in the community pharmacy. It's an easy thing to ask a patient when they're picking up their prescriptions, and you notice blood pressure medications in that list of meds, to say, how are you doing with your treatment goal? How's your home blood pressure monitoring going? Oh, you don't have a home blood pressure monitor? Let me show you
Let's
some
do
of
it.
the validated monitors that we have here, and we can help get you set up and help explain how to use them.
Yeah, absolutely. Yeah. So let's talk briefly before we get into deeper dives of some of those opportunities that pharmacists have to be involved. Can you speak briefly to the you kind of did. I mean, it's a huge impact to communities, to public health, but just in general, do you have anything to add about the impact of how uncontrolled hypertension can add to expenses and to hospital readmissions and just things of that nature that are further complicating the care of the patients receiving the optimal care?
Yeah, well, hypertension and cardiovascular disease in general is a complicated, multifaceted problem. And we're seeing increasing rates of metabolic disease, increasing rates of obesity. Obesity is a risk factor for high blood pressure, coronary artery disease, high cholesterol, diabetes. And so, I think this is a problem that so far we haven't done great on. In fact, I saw some interesting survey data that looked at awareness, treatment, and control rates in a survey between 2017 and 2020. And they compared that to awareness, treatment, and control rates in 2021 to 2023, and there was no improvement. And so, we're not headed in the right direction yet. And certainly with the rates of metabolic disease, like I mentioned, this problem isn't going away anytime soon.
Yeah, for sure.
So we're going to talk about a lot of different opportunities, but I think, some of the low-hanging fruit, easy things that we can do to reinforce throughout the health system, like I just said, something as simple as asking a patient how they're doing with their treatment goal. That doesn't take more than 5 seconds to ask. And it just sort of reinforces in their mind, oh yeah, I need to be.
This is important.
Yeah. So we're seeing in the cardiovascular clinic too, we're seeing patients are living longer. So they're developing some of the long-term complications of high blood pressure, like heart failure, like dementia, Alzheimer's disease. Hypertension is a risk factor for all of those things. And so, I think suffice it to say, without getting into some of the specific numbers and statistics, hypertension is a major driver of cost and
increased cost.
And morbidity and mortality.
For sure. Well, you kind of set us up perfectly to move into the next topic that I wanted to touch on. And so that is, you mentioned that asking the quick question, taking a few seconds, you see the blood pressure med is being dispensed, or you're doing a med rec review at an AmCare clinic, or something, and you notice that they're on hypertensive treatment. But how can we identify those? Like, what are tips and tricks for pharmacists to help identify those that are either untreated or undertreated? Like, if we're not seeing them being dispensed a hypertensive medication, do we assume that they have been checked and are good to go, or do we assume that they're one of those walking around that don't know that they have hypertension?
Yeah, I think because community pharmacists in particular are so accessible and well connected in the community, I think just from the awareness side of things, having blood pressure monitoring screening
Hmm.
available in your pharmacy,
Yeah.
whether that's through a health fair or any other community event, just to raise awareness of
Hmm.
hypertension as such um, a common ailment, and then offering those screening services. In
Hmm.
terms of those patients that have been diagnosed and are undergoing treatment, regularly asking about blood pressure treatment goals, making sure they're following up with their providers, and if you want to. If pharmacists are so inclined and they have the resources to engage in a more robust, hypertension management service, offering regular, frequent visits, whether that's phone calls or visits in the pharmacy to help bridge the gaps
Hmm.
in the patient visits with their physicians or nurse practitioner and PA providers, because we know that primary care services are in shortage,
Limited.
and
Hmm.
those clinics are often very busy and overrun. And so, when patients are diagnosed with hypertension and initiated on treatment, really regular, frequent, monthly follow up is recommended in the guidelines. It's well supported as a means to get patients to goal. And once they're at goal, then you can extend those follow up intervals to 3 to 6 or even 12 months. But I think this is a big deficiency in our healthcare system. And a lot of what we're going to talk about today isn't really any one part of the healthcare system, whether that's awareness and diagnosis or identifying the right treatments or making sure that patients are adherent. It's a systematic issue,
Hmm.
and it's going to take systematic solutions.
Hmm.
And
Yeah.
so, um,
There's no one quick fix for any of this. So yeah.
exactly.
Yeah. One thing I wanted to point out, you mentioned, and I always like to try to highlight things when I hear opportunities come from the speakers. And you'd mentioned, offering blood pressure screenings, having health fairs, partner with schools in your area. I am 100% sure that there are students who are active in some of the groups at the organizations on campus who need those hours, who need that service, who want to participate. And so there are opportunities there to tap into schools. So if you're near a school, partner with them and have their students come out and do, help fairs on Saturday or after school hours, or whatever. That's a great opportunity because I know, timing is not always easy to work in something new and to workflow. And I know that we're all overworked in pharmacy practice. So, but, tapping into those resources that we have. So I'm sure you would confirm, given that you're at a college of pharmacy, but, utilizing the students for that is a great opportunity as well.
Totally agree.
Yeah. So one of the other things that you have touched on, and let's dig a little bit deeper into it, is supporting adherence through either education or continued follow-up care, which you mentioned. So anything else in that space that you want to kind of point out as key factors to keeping people adherent and also at goal?
Yeah. Well, adherence is a complex problem that has any number of different causative factors. And so I think in a patient-centered healthcare model, it really starts with meeting patients where they're at,
Hmm.
getting to know them, building trust. So one of the first things I try to do when I meet with patients in our clinic is to simply understand how they feel about taking medications. A number of years ago, I read an article that was talking about some of the low adherence rates. It's estimated that 25% of initial prescriptions for antihypertensive medications aren't even picked up.
Mm.
And at 1 year, 50% of patients are not adherent. And
Wow.
so there's a number of different reasons for that. And it really starts at a real basic level. And so when I read that article about some of the challenges with adherence, and that we should really be talking to patients about how they feel about taking medications, I started experimenting with just asking patients, how do you feel? How do you feel about taking medications? And honestly, it felt a little bit awkward at first. We don't often dig into feelings, but it really opened my eyes a lot because most patients were telling me, I hate taking medications. And so you can imagine having that sort of mindset regarding medications and then being told, oh, by the way, you have high blood pressure and you're going to have to take medication probably for the rest of your life.
Rest of your life, yeah.
And here's your prescription and go and pick it up. Well, we know that I'm kind of oversimplifying things a little bit, but generally speaking, we know that the system of care that we've been providing has not been working in terms of adherence. And so at the point of diagnosis and at the point of that initial prescription, we need to have a discussion with patients about how they feel about taking medications, and most importantly, that they understand what the potential benefits are. When I talk to patients, I explain to them all medications have potential risks, and we want to balance that against the intended benefits. When I went through school, and you did too, we got a lot of information on how to counsel patients. And what was the emphasis on? In my recollection and experience, it was on what are the side effects of medications. That's certainly important to talk to patients about and make sure they understand. But we need to put equal, if not more, emphasis on the intended benefits.
Outcomes,
and highlighting treatment goals. And so if a patient's prescribed a medication and they don't really understand their overall risk of long-standing hypertension in terms of all the target organ damage, stroke risk, retinopathy, cardiovascular risk, kidney risk, peripheral arterial disease, hypertension is a driver of all those things. And most people understand that high blood pressure is bad, but they may not equate
to what extent.
To what extent. So we really need to make sure patients understand upfront what their diagnosis means and what the treatment options are, and that there are potential side effects. And if they experience side effects, that doesn't mean that nothing's going to work. Especially in the case of hypertension, we have a number of different drug classes. And sometimes it takes a little bit of time to find out what works best for each patient. Every patient's different. So I think that's kind of the first step. The second step is, potential barriers to care, whether that's access to care. In Iowa, where I live, a rural state, there's many other areas around the country that have, pharmacy deserts, or patients who have difficulty getting to the pharmacy, even if it's not a long ways away. We have a tendency sometimes to, quote, label patients as bad patients because maybe they don't pick up their prescriptions or they don't show up for a clinic visit. But if you really take the time to understand, we may have a better appreciation that, the patient simply can't make it. I'll tell you, I've had a lot of patients who I've noticed in the chart were labeled as, no frequent no-shows. When you talk to them about it, they say, well, I have to take off work. I can't take work.
Or I rely on someone to bring me. And if they're not available, then
Exactly. So those access issues are really important. And then I think just encouraging patients that if they do have a side effect or if they do have a concern, we want to maintain frequent follow-up and frequent communication so that we can address those patients' concerns or issues in real time. We see a lot of patients who come back for, an annual follow-up, and we end up finding out that they stopped their medication 9 months ago. And that's something we want to avoid if at all possible. The other thing I think it's worth commenting on is that there are a lot of errors in the medication record. And so it is an all too often occurrence where patients come into clinic and their medication list is filled with inaccuracies or errors, whether that's missing medications that are on the list that have an incorrect dose, or that they're simply not taking. We see a lot of fragmented care, especially at a large academic medical center. We have patients who receive care in their local community. They maybe are admitted to their local hospital. They're transferred to our hospital. There's all these transitions of care, which we know are a big driver for medication mismanagement and errors. And so I think it's worth pointing out that in all aspects of the healthcare system, pharmacists, whether they're in the hospital setting, the clinical setting, or in the community setting, making sure that we have an accurate medication list and that patients communicate that and have a good understanding throughout those transitions of care.
Yeah. Yeah. I love one of the things you mentioned, the fact that, going to an annual visit and finding out that they've not been taking it for 9 months. That is, again, a great place for the pharmacist to insert themselves, because, we would see that patient multiple times throughout that time period, and we would be able to say, hey, what's going on? It looks like you're not filling. Did you stop this? Were you supposed to stop this? Did you get changed to something else? And that kind of thing. So, yeah. So again, and I also love the stress. I used to stress the same thing to my students as well, is education and counseling is not just what are the potential bad things that might happen and don't worry about them. It's also about what are the benefits of this? Like what are we trying to achieve? And if you take it, what's going to happen? And if you don't, what's going to happen? Like that, not scare tactic, but sometimes it's important to show what are the risks versus benefits of you actually staying adherent on the medication? So,
absolutely. Yeah. Hypertension is often referred to as the silent killer. For the most part, patients don't feel when their blood pressure is elevated, right. But if they have a side effect, they may very well feel that. And so, one of the things I do try to emphasize, because most patients, when they come in with a hesitancy to take medications, they'll tell you, well, I just had a patient yesterday. I got on the internet, and I Googled and I saw all these side effects. And I said, yes, and again, I go back to what I mentioned earlier is I emphasize to patients, all medications have potential side effects or risks. And I think it can also be helpful to really break down possibility versus probability. And so, possible side effects are listed in that laundry list. But if you really break it down, the probability of most of those side effects are highly unlikely. And so you have to, again, because our patients have a wide range of health literacy and ability to understand information, you really need to individualize your education and how you break that down for patients. And so, there's a few different things that I will communicate to patients to try to help them better understand what that really means in real terms for them, so that ultimately they can make informed decisions.
Yeah. So one of the things before we run out of time that I also wanted to touch on as far as like an opportunity, and I always feel like this is something that we always talk about, but it's not always the case, to bring it up and to discuss it as the pharmacist, is addressing lifestyle factors and how big of a role that they play specifically in hypertension, which is what we're talking about. So can you speak to diet, sodium intake, activity, those different things and how they affect how well the medications work in a patient, if we can talk about that for just a few minutes.
Yep. What we call the therapeutic lifestyle recommendations, or TLC, is, fundamental to all health. And really, these therapeutic lifestyle recommendations are important, especially for people with high blood pressure, but really anyone, and not just those at risk. So when we address hypertension with patients and they're starting therapy or they're picking up those refills, it's also important to emphasize therapeutic lifestyle. And some little pointers for your audience to remember. Sodium is a big driver for hypertension. So the optimal goal is less than 1.5 grams per day, but even lowering sodium intake by 1,000 milligrams or 1 gram a day can lower blood pressure 4 to 5 millimeters of mercury. Weight loss is also important. And 1 kilogram of weight loss can equate to about 1 millimeter of mercury
Wow.
lowering of blood pressure. So 1 kilogram or 2.2 pounds. Regular physical activity, the recommendations are 150 minutes per week. That can lower blood pressure 5 to 10 millimeters of mercury.
Hmm.
And then a couple of the other recommendations, increasing potassium intake. And the recommended range for that is 3.5 to 5 grams per day. So potassium, emphasizing those potassium-rich foods, bananas, oranges, potatoes,
Hmm.
tomatoes, which should really be part of the next therapeutic lifestyle, and that's the DASH diet. So a diet rich in fruits and vegetables, whole grains, low-fat dairy, and lean meats like fish and poultry.
Hmm.
And then the last thing, which maybe is underappreciated, is the impact of alcohol on blood
Hmm.
pressure too. So recommending that patients, women, one or fewer drinks per day, and men, two or fewer drinks a day, can also help. Combined, all of those things, if patients are really successful, can lower blood pressure 10 to 15 millimeters of mercury
Sure.
alone. And they also play an important role in the effectiveness of antihypertensive medications. So, if patients are on a thiazide diuretic, for example, and their sodium intake is exceedingly high, it's going to negatively impact how effective those medications are. And
Hmm.
so, you know, this therapeutic lifestyle recommendations really are the foundation of treatment.
Yeah, yeah. And, I think it's important. You mentioned all those little things, and even it, changing salt intake and changing it by, 1 or 2 millimeters of mercury. Like, sometimes it's that last hump to get over to get controlled that people struggle with. So these slight little tweaks can make a difference, like it seems like, oh, well, that's nothing. I'm just going to continue to eat my salt. But if you add it all up, and if you lose 10 pounds because you're exercising and you also change your diet, then boom, you've got lots of change in your readings. So yeah.
Absolutely. And, back to one of my other points, how a lot of patients are averse to taking medications, emphasizing the importance of lifestyle in
Hmm.
improving blood pressure control can
Yep.
be a strong motivator to either avoiding medications
Yep.
or being able to decrease medications. So we're
Yep.
seeing that a lot now with, GLP-1 agonists having such significant weight loss.
Hmm.
This is something pharmacists should be monitoring closely, because we may be able to de-intensify antihypertensive medications. And, we don't want to end up in a situation where patients are hypotensive or
Right.
overtreated. So,
Right.
um,
Yeah. Yeah,
yeah.
it's a great point. I mean, speaking from experience, having lost weight in the last year, and I was teetering on that every time I went to the doctor. They were like, "Yeah, you're really close. Your blood pressure is not really looking great. We're going to monitor it and whatever." And now, of course, all the other things that go with it, cholesterol numbers and all of that. But last time going and seeing that after the weight loss, and it completely changed. They're like, "Yeah, it's not even a concern anymore." So, just like you said, that's a great incentive as well to say, hey, okay, you hate taking medication, you hate the medication altering effects or whatever. Well, let's get your lifestyle under control, because sometimes that can prevent you from having to take it. So yeah, great points as well.
Yeah. And
So
go
go
ahead.
ahead. I'm sorry.
I
No,
was
go
just going
ahead.
to say real quick, I think this is a big opportunity for community pharmacy too.
Hmm.
Um, Despite the knowledge that all of these lifestyle recommendations, diet, exercise are important, it's often, speaking from the clinical side, often not addressed in a meaningful way. And a lot of patients, they want that information. They come in asking for it. So I think the more we can do to emphasize each of the things we've talked about today throughout the continuum of care,
Hmm.
patients are going to, number one, feel like they're cared for. They're going to be actively engaged and involved in their health, um, and just be more confident in the process.
Yeah, that's great. So, just as a brief recap of things, all the different ways that pharmacists can interject into this management of patients with hypertension. So we've got accurate education on accurate technique. We have counseling and focusing on the benefits and the outcomes of those medications. So counseling on that. We also have uh, making sure that they are taking them, so adherence. We're also double checking to make sure that they are that they're able to get to their visits and they're able to get to their doctor, checking for any kind of social determinants of health issues that we're looking for there. And medication costs, we didn't even get into that. That could be a whole nother podcast just in and of itself. And the fact of, if they're prescribed one thing and the prescriber didn't realize that it was expensive and not covered, and there's a generic opportunity or there's another drug that's similar, like that's a whole nother place where we can insert ourselves and really impact adherence and people actually filling it for the first time. That number that you mentioned, every time I hear that, where 25% of prescriptions are just never even picked up, like it baffles me. And you hear the same thing. We had a cholesterol podcast recently, and it was like, I think it was even higher, like 50% never even get their medication to lower cholesterol. And so just mind blowing. Like if there's ways in which we can be in that process to really even help convince, I know that that's kind of a bad word, but convince with good reason the patients to pick it up and to take it, that's a great opportunity for us.
Yeah, and I think that's one thing we didn't really talk much about today in terms of optimizing medication regimens. And I think, from a pharmacist on the prescribing clinic side of things, that's one of the things I spend a lot of time doing is working with the patients and the prescribers to identify a regimen that will work for them, whether that's to make sure it's covered by insurance or it's a regimen that they can easily fit into their daily schedule once a day, twice a day. If we're using a combination or if we're using two or more medications, can we get that in a combination pill? There's a lot of things we can do to try to simplify regimens and let that be a driver of adherence and improving patient care.
Yeah, for sure. So again, another opportunity is the collaboration of care with prescribers and making sure that the continuity is there. And so many opportunities for pharmacists to really get into this space and to help patients have better control of their hypertension. And we even talked about how they can become aware of hypertension and be aware that might be something they need to look into. So what would you say, as I always like to end with turning it back around to the title of our session, which is Game Changers. What would you say, Ryan, is the game changer here? Like what is the game changer? Is it the alarmingly high rate of people who are walking around with hypertension and don't realize it, and we can get involved there? Like what do you think is the game changer for pharmacists in this space?
Well, I think because hypertension is such a big driver of cardiovascular morbidity and mortality, and because we have well-established treatments that lower cardiovascular morbidity and mortality, the game changer is really, as a healthcare system, as a pharmacy profession, identifying those things in our day-to-day practice where we can move the needle just a little bit, whether that's one patient at a time, one provider at a time, one drug at a time. I think, it's going to take a concerted effort on all of our parts. And I think, it really could be a game changer if we all do that. And over time, we're going to see significant changes. So I think
the trend's going in the right direction.
Absolutely. Absolutely. And I think, if we want to develop public health initiatives, if there's one thing we could do to affect health, because hypertension is so prevalent and such a driver of adverse outcomes, go after hypertension. Let that be your initiative.
Yeah, I love that. I also love that you almost try to make a new word, and I'd like to normalize it, because saying morbidity and mortality over and over, I think we should just call it mortality and just run with it. Yeah, let's normalize that. I think that would be super easy to say. So, well, on a serious note, Ryan, thanks again so much for your time. This has been great. It's been really helpful to hear, the goal of the podcast every week is to say, here is something you can do as a pharmacist. And it always just surprises me how many different ways, we could be involved in the medication use process. And so it's great to have that perspective from such an impactful disease. So again, thank you for your time. We really appreciate it.
Thanks for having me.
If you're a CE Plan subscriber, be sure to claim your CE credit for this episode of Game Changers by logging in at CEimpact.com. And as always, have a great week and keep learning. I can't wait to dig into another game-changing topic with you all next week.